181 1st Street.
Overdose for 911.
Opioid overdoses kill more than 115 people every day in the U.S., according to the National Institutes of Health. Overdoses on heroin, synthetic opioids including fentanyl, and the misuse of prescription pain relievers are taking lives in the cities and the suburbs.
Now we know that addiction and certainly the opioid use problem cuts across all demographics.
The AMA Alliance, along with the American Medical Association, is fighting back, knowing the misuse of opioids is a complex issue that requires action from a lot of people.
It's time that we all work together, redouble our efforts, and fight this epidemic.
The AMA Alliance is addressing the epidemic with initiatives in communities across the country.
It's a multifaceted problem. Not just one thing is working. So that's why we're all speaking out. We're all supporting the efforts of the AMA. The Alliance is very cause-related, and we can get out into the communities and really be the boots on the ground.
They're mobilizing armies of volunteers focused on a comprehensive public health approach built on compassion and dedicated to finding treatment and recovery options for opioid use disorders.
My theme this year has been making connections to make a difference.
Partnering with PTA, for example, this video that's going out, will carry our message.
Does anybody need a packet?
Another way of delivering a message that help is available is this opioid toolkit, delivered door to door by AMA Alliance volunteers. It's an initiative that's going nationwide.
To know that I may have saved that one individual.
It's life-saving information for families who tell horrifying stories.
I've seen them die and been revived.
Overdose victims are brought back by emergency services. Several thousand are treated daily.
You were purple because you weren't breathing.
Lives are on the line, and seconds matter. And at Texas A&M University, the Opioid Task Force is sending a message and aggressively distributing naloxone rescue kits, essential in those precious seconds.
This is an opportunity to interject yourself into the opioid crisis and actually move the needle on the number of overdose deaths that we have.
Naloxone is the overdose reversal drug, and it comes in several forms.
So you're going to get a nasal naloxone?
There are vials of naloxone with needles, test strips to detect illicit fentanyl, a big reason for the spike in overdose deaths, and an auto-injector complete with voice guidance.
It tells you exactly what to do.
To inject, place black end against outer thigh. 5, 4, 3, 2, 1.
Give it away. That's the idea. Give it to whoever needs it, and we'll get you another one.
It literally saves lives.
Hospitals across the country are stepping up naloxone training.
If you elected to have your patient in a sitting up position, if they are not completely unconscious and you decided that you wanted to give them something intranasally.
Backed by the Emergency Nurses Association, a New Jersey hospital is attacking the epidemic on another front with dramatic results.
We had an 85% reduction in the prescriptions that were written for opioids.
The ALTO project is an acronym for Alternative to Opioids. It's now part of federal legislation, a national template. And while it reduces prescriptions, it also focuses on improving access to non-opioid forms of pain care, options that health insurance companies have been resistant to cover. The overall legislation is a measure of the power of some 43,000 ENA members.
It's a strong advocate, but it's a loud advocate as well.
The new president-elect of the AMA is having AMA advocacy take center stage.
We know that too many people are dying preventable deaths when we know how to help them. And one of the ways to help them, of course, is increasing access to treatment for those who have an opioid use disorder.
Dr. Patrice Harris is all about local community involvement and increasing access to all forms of treatment.
It's an illness. It's a medical illness. It's a chronic illness. We don't have a cure, but that's not unlike diabetes or high blood pressure.
She is also adding momentum to the Alliance battle against the devastating effects of stigma.
It's easy to pass judgment, and that's really what stigma is.
Removing negative biases is one of 6 specific AMA Opioid Task Force recommendations.
They are the front line for the community. and we're here to support them, and we want to make sure that they know that we're here to help them as they continue to do their job and as they continue to keep the citizens safe.
The DEA is also a key partner and collaborator, committed to supporting doctors and the healthcare community.
We all have to work together to reduce the amount of drugs out there on the street that could be diverted so we can end this opioid crisis that much faster.
This Practitioner Diversion Awareness Conference held in Nashville helps the Drug Enforcement Administration showcase its work in education and awareness, helping bring an end to the opioid epidemic.
You had said this is a story that ends in hope, but is this story over?
We're definitely making progress, and if we continue with hope that tomorrow will also be a good day.
Tomorrow begins with action today for the AMA Alliance and all of the volunteers.
I leave these meetings energized and motivated, and I want to go home and do something.
Because everyone has a role in reversing this epidemic. Don't wait. Get involved. Go to AMAalliance.org.